The knowledge base of what we do in medicine needs to have advanced to the point where you understand what a cell secretes, how cells communicate, and what growth factors are, and what an exosome is, and the different types of things. The medical industry as a whole, and in particular, I think big pharma, realized very early on that cell therapy was the way the human body works, and they had to get ahead of the narrative before the science of using your cells to help you heal got kind of out of control. All right, everyone. It's been a bit. Welcome back to the Zero Downside podcast. Really appreciate all the support from our subscribers. Please remember to like and comment on the episode, hit that notification button. We are starting today, and one of the reasons is we've kind of taken a few weeks is we're right in the middle of, a big rollout to make products available to patients that have been very difficult to make available to patients. And with that, it all came down to sourcing the appropriate, clinically tested, GCP certified type of lab setting to roll out peptide therapy to our patients. It used to not have to be so complicated. The compounding pharmacy side worked really well for us for a really long time until the FDA decided to mess that up. And by making the sourcing of the amino acids, which is all these are amino acid chains, okay? Naturally, these are synthetic substitutes of a naturally occurring amino acid chain. That's what a peptide is. It's, a peptide that gets bigger becomes a polypeptide. A peptide that's polypeptides becomes a protein. If they're giant forms of amino acids, it could be a hormone, a prohormone, a ligand. Anyway, all that is peptide therapy. And before the FDA decided to rattle the saber and try to ban everything that wasn't a drug or make it go for drug approval, they tried to just take down the ship by casting doubt on the safety and efficacy of a therapy that we've been administering to augment patient care on what we do in orthopedics, trauma, reconstructive, aesthetic. On the surgery side, using bone marrow, amniotic tissue, cell therapy, we've been using amnion therapy, peptide therapy, nutritional therapy for a really long time to bring kind of all the pieces of wellness together for a patient. That's what we do. That's why this was so unique to have an orthopedic surgeon that's not just going to cut on everything that walks in, because that's the highest, best use of my time. That's not necessarily the highest, best use of my time, by the way. If you don't own part of the medical establishment, honestly, it's not even reimbursed as well as it should be. But to be able to bring all the different toys together, they just kept making it more and more and more difficult. While there was compounding pharmacies, we could just write a script under prescriptive authority. Patient could pick up a peptide. I could tell you what the concentration was, how to take it, what desired effect you want, and that was our goal. When they went after the compounding pharmacy side and then the research lab side, basically what they did is they took peptide therapy out of a doctor's office and put it back in a gym bag. So you're at the gym and your elbow hurts and you mention it and 5 guys pull out BPC out of their gym bag. Hey, you should try this. Well, where'd you get it? Well, what's in it? What's the dose? How concentrated is it? What, they don't know. And where they got it from doesn't know. Because if you get something from a research lab, and not to say I haven't done it, during some periods of time over the last few years when we had some accessibility issues, not only through compounders, but through some of the labs we were working with and have been working with for years because of the FDA regulatory status of a lot of these peptides, there became some real accessibility issues. And so research labs were the way to do it. But there's something really uncomfortable as a physician giving a patient a peptide that comes with a 2-page disclaimer about this is not for human use, don't inject it, there is no safe dose. That's not what I should be promoting or helping a patient obtain. In a best case scenario, we should be able to work with the lab, with the formulations to come up with exactly the dosing instructions that I would want a patient to have, depending on what the clinical indication for what I'm putting you on is. And that's the reason for all this, is because we wanted to combine the best of what's available on the research lab side as far as peptide accessibility. There are a dramatic number of peptide therapies available for patients, depending on what your goal, what your ailment, what the symptom you're trying to alleviate, what injury you're trying to get over, what your goal of feeling better, neuroplasticity, how do you want to feel, what are you trying to get over? That's what determines what's the best peptide for you. I'll get 5 texts a day. Hey, what's the best what peptide do I need to be taking? What peptide do my parents need? My question is always the same. What's your goal? What are we trying to treat? Do you have a symptom I'm trying to alleviate? Am I trying to help you get through a stressful situation in your life? Am I trying to help you get over a chronic injury? Am I trying to help you deal with a chronic health condition? All those things, I have a different aid in helping you achieve that based on what peptides do I have available? Do I know how much, what the concentration is, what the dose would be, what can you take together, how would we stack these? Yes, all that. And it needs to be a physician's responsibility to figure that out. Not just turf that responsibility as your physician because, well, we can't really get it, they don't really have it. Even with probably the most common, actually I actually call it the gateway drug to peptide therapy, is BPC-157. And BPC-157, the reason I call it the gateway drug is because we don't write for peptide therapy to make a difference overall. And at the end of your life, you look back, wow, you lived 2 years longer because we did all this stuff. This is about alleviating the binds of chronic injury, illness, and dysfunction, or pain and inflammatory load and metabolic issues. This is about alleviating suffering and bringing healing to the human body, helping it function on a higher level the way it was supposed to. That's what peptide therapy should ultimately be about. How do I make you function as a better version of you? What peptide you need depends on what is your symptom, what is our goal, what's your chronic injury pattern. But BPC has been just clutch for a lot of people for a long period of time. The narrative against BPC, and I'm going to keep hammering this out because every day I ask people, and still the great majority of people don't know what BPC stands for. And I think that when you try to figure out a narrative of why do they go after BPC so hard? Well, the same reason I had to support it so much, because I do think it's a very important clutch little peptide that opens your mind enough to think maybe there are other peptides that could have similar effects for different problems. And that's what I mean by, the gateway part of it is just opening your mind to something out there that's not a traditional prescription filled at a pharmacy, covered by insurance, that is probably not a naturally occurring substance. And we're hoping that the side effect of the substance I'm giving you is therapeutic. That's what most medications are. Peptide therapy should not be about that. Peptide therapy should be about the augmentation and of better natural function. What is physiologic and optimal? That's what peptide therapy should be, is about achieving optimal health, optimal function, optimal recovery, wellness, generalized health. BPC stands for Body Protection Compound. how the FDA, in their infinite wisdom, could decide to make something as hard to obtain and talk about through a physician as they have with body protection compound. I get it if it was called this could cause cancer, right? TCGF or what? Like, no. This was isolated first from gastric secretions in the human body. This is how you kind of protect yourself from ulcer. It's part of the immune system. It's a big function of part of the myotome. What did muscle secrete? Muscle is a secretory organ. God didn't waste all this real estate. Not that I have that much muscle mass, but in the human body, 80% of your body weight is the musculoskeletal system. And that's not created just to get you up and moving from one place to the other. Muscle is a secretory organ, has an intimate vascular supply with capillary beds. The capillary bed is a really good place for stem cells. The stem cells could secrete all 7,000 naturally occurring peptides. I can write you a script for about 40, maybe 60. I don't know that there's a lot of spillover of a lot of different things that work together. I think we've outlined that a little bit with the BPC TB500 kind of compare and contrast episodes. I think that the TB500 or TB4 or T4, that discussion can be a little bit more in depth than just overall muscle mass. I think that the thymosin and the thymosin-related peptides can be really crucial in overall maintaining muscle mass, especially in light of large weight loss, whether it was intended or unintended. I think that BPC 157, when you look at overall pain, inflammatory load, function, the reason it's so popular is because it works so well. The evidence of injecting it closer to where you're hurt is maybe anecdotal, but it's anecdotal over thousands of cases. So when someone has elbow pain and they talk to someone at the gym and they start injecting BPC around their elbow, and within a couple of days their elbow doesn't hurt anymore, it's fairly significant reinforcement that it was efficacious because it did what it was supposed to do. And it was safe, even given in the most unsafe of circumstances, out of a gym bag from someone that doesn't know how much is in it or how much you should take or how much you weigh, or are you allergic to things? Do you have fish out? Like, are there things that might complicate your use of this peptide? Because the answer is probably yes. And that's why the medical direction of this it was so important to us. We worked really hard to... And against it wasn't like it was a conscious decision that, hey, we just need to make it MOAB peptides. No, it kind of came down to, if I wanted these to be available patients, I had to be willing to step up and start putting a label on it that I could get the peptide manufactured in a GPC certified lab without the research guidance, with some big disclaimer, and still keep it under prescriptive guidance on a per use for each patient, outlining how to take it with phone calls and a phone line to help us guide you through the administration of peptide therapy. Because this shouldn't be like taking some vitamin that you didn't know whether it worked or not. This isn't to make your life better in theory. This isn't like lowering your cholesterol. Oh, I lowered my cholesterol. Okay, and so what? Right? Do you feel different, feel better? When we direct someone into peptide therapy, it's because we have a goal and we're trying to accomplish that goal, whether it's obtaining faster recovery through a surgery, whether it's less inflammatory load in a shoulder, whether it's trying to not have surgery, whether it's making your hair grow better, whether it's making your skin younger, whether it's part of the microneedling procedure that we use this peptide because it helps you recover better and you end up with less treatments overall. We have a goal in mind, and now, for the first time, we actually have a full peptide line of therapeutic products based on the best research and laboratory technology available to create custom stacks of peptide and helped direct therapy with our team. Once we know what it is your goals are, what illnesses we're treating, we can bring the full arm of technology with what's possible from a peptide lab perspective now, that I think it would be very difficult to put together, starting over with one compounding pharmacy that can't do this peptide, but they can do this one, but this one's cheaper here. And it got so complicated. And I know some of our patients were caught in that mix where we're ordering peptide from someone and it didn't come. They said it was going to be here on Friday. Well, I'm sorry. Like, we're not the ones that said it would be here on Friday. We were told that, right? We just got caught in so much of a mess on the delivery that what I didn't want is for us to work as hard as we do to take care of patients in a high quality way and be undermined by the delivery on the peptide side because we were told one thing and that didn't come true. At this point, I feel pretty comfortable saying that shouldn't happen anymore. There is some delay sometimes in the production of what's in here to what is in here, but I think at a rate on creating some of these stacks, and especially now that we're getting ready to go into a whole new era of some oral absorbable forms that may change the future for a lot of people. I think on the injectable side, when you look at the popularity of NAD plus to replace Adderall, when you look at the popularity of BPC 157 to replace some of the long-term pain medicines and anti-inflammatories people are on, when you look at Salonc and Samax to get people off of benzodiazepines with significant addictive potential, and Salonc and Samax have no addictive potential, you look at to remove people from that psychotherapy dynamic of I'm on 5 antidepressants, one to help give me the energy that this one took away, and one to help me sleep, and this one instead of all that, if I can just help you function more divinely, because I think that's where Western medicine gets it wrong. You guys have probably heard me say this. Anyone that's seen me as a patient will eventually hear this, that where Western medicine messed this up, and this is the last thing I'll say in this episode, but where Western medicine messed it up is when they fail to acknowledge the divinity of the creation of this device. The human body, if you recognize that it was divinely created, then we're the ones that mess this up. Thousands of years of processed food, adding poisons to your water, stress, cortisol, UV light, not getting exercise, eating the wrong things, processed sugars, refined flour, all the unnatural things that we've done, lied about what's healthy for you to eat, created false narratives to trick people into not using salt and not eating eggs and staying, fat-free, sugar's better than fat. All that stuff is a lie, and it's all wrong. And it started with the lack of acknowledgement of this. If this is divinely created, and I truly believe it was, then how do we help it function more like it was designed to function? That's where you get away from Western medicine. That's where you go with peptide therapy. You go with the science behind cell therapy, what the cells secrete. How does this heal? How do I get you less broken? How do I pull you out of that inflammatory load? Peptide therapy is a huge step to get you off of a lot of the handfuls of institutional poisons that most people are on, and out of that, I'm sick and describing you as in the terms of a diagnosis instead of a person that is having some health issues, that we should be able to help your body figure out a path through and recover from. And that's really where the science of peptide therapy functions, is restoring the divinity of the functionality of how you would handle an event of a stroke. How would you handle the inflammatory event of leaky gut? How would your body handle? That's where peptide therapy comes in. This is what the body would attempt to try to get you over that or avoid that problem. These are the root substances that are the chemical pathway of communication between the cells in your body and the system that's broken. That's why this is so revolutionary, is we're just trying to help you function in a way you were designed to function. I don't think it has to be that complicated. The science behind the peptide analysis of what peptides are involved in certain pathways in a healthy person is really solid. All we have to do is find ways to help augment and reconstruct that for someone. And that's really good science. And it's all about health, wellness, and not about treating a disease. With that said, I know that my producer has been giving me 1 minute signs for a few times. I get that it's easy to get wrapped up and passionate when we talk about introduction, not only of an entirely new access to peptides for patients, but a significant payoff from a lot of hard work that came in getting to this point where the products are actually available for people, and we're trying to make the availability and the scalability of getting you taken care of appropriately accessible to people from all over the world. With that, I want to say thank you for your time and attention. Please remember to like, subscribe, hit the notification button. And again, thank you for tuning into the Zero Downside podcast. I'm Dr. Wade McKenna.